Retirement is all about enjoying your golden years. But what if you want to get a jump start on those golden years? For a myriad of reasons, many people are contemplating retiring before their years turn golden. In fact, according to a survey by financial services company Empower, Gen Z aims to retire earlier than any other generation, by the age of 59. Retiring early sounds like a dream until you consider the costs of healthcare, but there are numerous options for healthcare insurance for early retirees. In this video, we're going to explore those options. Hey everyone, this is Andy Hill from Marriage, Kids, and Money, a channel dedicated to helping you strengthen your family tree and live financially free. A quick shout out to our video sponsor, Empower, the #1 retirement plan provider recommended by financial professionals. To get the answers to your money questions and move toward your version of financial freedom, check out their newsletter by accessing the links below or in our video description. Okay, let's talk about healthcare costs in America first. Before we explore the various options for health insurance for early retirees, let's talk about one thing that isn't an option: simply choosing to ignore the need for health insurance. Healthcare costs in America are simply too high to shoulder the burden alone. An estimated 100 million Americans carry at least a collective sum of $195 billion in debt. It follows then that more than 500,000 people declare bankruptcy each year while citing medical debt as at least one factor in their decision. With the high cost of healthcare in the United States, it may feel like early retirement is out of the picture. Fortunately, early retirees do have health insurance options. Let's dive into 8 options to see which might fit best into your retirement plans. Insurance from a spouse. Perhaps the simplest workaround for keeping your insurance coverage in early retirement is to stay on your spouse's insurance plan. But what if both you and your spouse are eyeing early retirement? Or what if you aren't married at all? There are other options for health insurance for early retirees. The next one, marketplace. Another way to keep insurance coverage as an early retiree is to purchase health care from the health insurance marketplace. If you purchase health insurance from the marketplace while you are working, you might expect to find similar high costs during early retirement. However, as an early retiree, you might discover that your deductibles and co-payments are much cheaper. That's because certain household sizes and income amounts result in premium tax credits and savings. As such, the premiums you pay as an early retiree may be surprisingly small. You can visit healthcare.gov to see plan options and estimate a cost for you. As you plan for early retirement, being able to estimate insurance costs will help you better determine how much you need to save for retirement. In fact, this is the route that my family has gone for the past 3 years, and it's worked out really well, honestly. For our family of 4, our healthcare costs are around $1,200 per month as of the time of this recording. So it's not cheap, but it has allowed both my wife and I to work part-time and still stay covered through health insurance. Then there's health share plans. Perhaps a lesser known option to getting health care coverage is through a health share plan. These plans, sometimes known as health share ministries, aren't actually health insurance. Instead, health share plans are a group of members who agree to pool their money to cover the costs of medical care for one another. Generally, care coverage is limited to basic health care and catastrophic care. You also want to note that there are some tricky parts of navigating health share plans. In addition to typically needing to submit a statement of faith, many health share plans do not cover pre-existing conditions. As a new member, you may also have to pay into the plan for several months or a year before requesting coverage. With any type of health care coverage, you want to do your due diligence so you're not faced with any surprises when it comes to your health care. This is especially true with health share plans since they are not subject to the same laws as health insurance companies. Then there's private health insurance. Another health insurance option for early retirees is to purchase private health insurance. This process is similar to looking for insurance on the marketplace. However, since these plans are purchased privately, you may discover that there are more plan options available. But an important consideration with private health insurance is that the premium tax credits they don't apply. Therefore, the cost could be higher depending on the plan and other factors. Then you've got Medicaid. Since you are no longer bringing in an income when you retire early, your household income is likely to drop significantly. Due to this drop in income, you may qualify for what's called Medicaid. Medicaid is a federal program, but it is state-run. Therefore, you're going to want to investigate the offerings specific to your state. As an example, in my state of Michigan, the maximum income level per year to qualify for Medicaid for a family of 4 is $39,900 as of the time of this recording. And then you've got COBRA. Most employers are required to offer coverage through the Consolidated Omnibus Budget Reconciliation Act, or COBRA. However, they are not required to subsidize it. As a result, you will likely be required to cover the full health care premium. Plus, this coverage runs out relatively quickly with a maximum amount of coverage of 18 months in most instances. COBRA can be helpful when looking to initially bridge the gap between early retirement and when Medicare kicks in. However, it's important to consider the high cost and compare it to other options, such as purchasing a plan through the marketplace. Then there is an employer-sponsored health insurance benefit. While this option is becoming increasingly rare due to the high cost of healthcare, some employers offer health insurance as a retirement benefit. In fact, there are some employers who will even continue to cover a portion of the monthly premium. It's also important to note that this retiree health benefit is usually designed as a supplement to Medicare. When you reach the age when you can sign up for Medicare, you may be able to keep your retiree health plan as a supplemental policy. You could also go for part-time work or barista fire. If you're interested in retiring early, there's a good chance you're already familiar with the Financial Independence Retire Early, or FIRE, movement. One contingent is barista fire, which still involves part-time work, usually for healthcare benefits. The biggest perk to barista fire is that you can typically leave the traditional 40+ hours workforce much earlier, because part-time work means you draw less down on your portfolio, meaning you need less saved for retirement. Plus, if you are able to find part-time work that includes health insurance benefits, that's one less thing you gotta worry about. Some big name companies like Starbucks and Amazon offer health insurance benefits to part-time employees. In the end, although many people are interested in retiring earlier than the traditional retirement age, losing health insurance in the process can feel like water poured on the flames of early retirement dreams. Fortunately, there are various options for health insurance for early retirees. Explore these options that we reviewed in the video today and use retirement planning resources to prepare accordingly. Speaking of awesome retirement planning resources, Empower is an excellent source for that information. Their advice and guidance through their newsletter helps people planning for a comfortable retirement feel much more at ease. Check out their newsletter by accessing the links below or in our video description. Thanks for hanging out today, everyone. This is Andy from Marriage, Kids, and Money signing off. Carpe diem.